Hey guys, and welcome back to another Surgical Tech Tips. Today's video is a 100% sponsored video. Yes, the first sponsored video of Surgical Tech Tips. So hashtag ad, I'll have to put that up here somewhere. I got contacted from a company called Haden Medical. They are an instrument company or a device company based out of California that sell instrumentation. And I have worked with them to create a video about one of the instruments that they sell online on their website, and I just want to share it with you guys here. So I'm going to leave a link in the upper, what is that, right hand, left hand, whatever side of the screen that's on, and I want you guys to click that. That's going to be the official video from the Haden Medical website or the Haden Medical YouTube channel. But this video here I'm also going to include, and just wanted to share it with you guys out there that are interested in the device called the Martin Arm. First things first, I'd like to demo the Martin Arm and show you guys how to install it on an actual OR table itself. Let's note here our side rail on the OR table. We have two notches on this rail, and we got two notches on this back rail as well. It's important to note that because you really don't want to be installing and tightening the clamps over these notches. So we're going to go to the solid bar here, and we're just going to install it on the bar with our rail clamping knob on the bottom, and it's as simple as that. Basically you just tighten it up and that's it. Now installing this clamp can be done off the field. You can pass this off to your nurse, your OR nurse, and they can go ahead and install it on the rail. This does not have to be installed sterile. This, however, the bar needs to be sterile. So the surgeon or the surgical tech at the field is going to be passing this off over their drapes and placing it through the hole of the clamp just like that. They're going to set it to the size that, or the height that they would like to adjust it to, and the nurse will just clamp down on the bar, and it's as simple as that. It's not going to move up or down, move left or right. Solid. One important thing to note here though is the height of the Martin Arm bar itself. These do come in separate lengths. This is just a normal size, but it can come in an extra long length as well for those big bariatric patients. So now that we have the Martin Arm installed on the bed, it's ready to go. You'll notice we have three joints here. We have proximal, central, and distal joints. All of these joints are obviously going to be utilized for manipulating the Martin Arm to the perfect angle that you need for your retraction or for your scope holding. So let me loosen this up a little bit. I'm going to go ahead and install our Richardson retractor here on the Martin Arm and loosen up our central joint. I'm going to find the right angle that I want. And just for demonstration purposes, I have a couple towels here to showcase the hands-free retraction that you can accomplish. Now, if I had a quick release and I have a laparoscopic scope, I could install a scope on here, and you could have hands-free laparoscopic scope holding as well. Now, there are many use cases for this Martin Arm device for the surgical procedures. It could be something as simple as holding a laparoscopic scope for pretty much any laparoscopic case. It could be used for liver retractor, on hiatal hernia repairs, Nissens, lap choles. There's a multitude of different cases where you can utilize this for a multitude of different devices. Don't forget just your normal retractors as well. Army Navies, Devers, just Richardsons. It can be used on a lot of different things. Personally, I've used them in my hospital on a multitude of carotid endarterectomies. We use an Army Navy with it. I have used liver retractors on hiatal hernias, and we even use it for specialized surgeries in the heart room for some of our minimally invasive procedures that we do. Now I want to talk about a couple troubleshooting techniques that I've seen and utilized myself while using this Martin arm. If you find like you're not getting enough angle out of each of the joints, you might want to notice that there's notches in each one of these joints. If you position the notches to accept the bar, you'll be able to get a 90-degree right angle out of each of these joints at the proximal and distal ends of the retractor. If you're at the field and the surgeon is saying that the bar is moving on him like this should not be able to rotate. It's because your bed clamp here isn't tight enough. You tighten it a little bit more and it won't move. And lastly, if you notice after it's installed on the bed that you have a little bit of play back and forth, it might not be the actual device itself. It could be the actual bed rail on the side of the bed. For us on this bed, we have a bunch of Allen screws that secure the rail to the table in place. A lot of the times these become loose, so check that as well. Alright, thank you for watching this informational video on the Martin arm retractor from Haden Medical. So that's it. That's the first sponsored video. I have one more video that I'm going to be doing with them too on a lighted breast retractors. But I hope you guys enjoyed it. I hope it wasn't. I hope it was still informational for you. And as always, thank you so much for the support. Thanks, guys. Bye.